Okay, it's fine. So, okay. And since you guys don't like talking, I would have loved us to have an interactive in a session, but and I'm not getting a kind of verbal feedback that I expect. Okay, just in case, we have not met before, so let me put it to the speaker mode. So just in case you meet me for the first time, uh, I am Dr. Osahon Ogbeiwi. I am an associate uh, professor of community medicine in UNIMED, and and I say you are welcome to your community health posting that you started this week. So the topic assigned to me is actually very simple, and I've been asked to take you through the definition and types, definition and types of health research, and uh, also at the end of this class, I will also take you through identification of a study topic. Uh, and I take it that it is at this level that you start at thinking about the topic for your research project, uh, for your community medicine research project. So how do you know which topic your group, your team, uh, will select uh, uh, for a project that you will do from your 400 level? And maybe the proposal you will eventually write in your 500 level, and then you actually present when you reach, you now defend it in your 600 level. So let us talk about the lecture outline. And the lecture outline, where we'll talk about what is research. Then I then talk about the types and the classifications of research. And then both the definitions and types, we will still relate them to health research. So that in a way, as we talk about at, at the research generally, we will also look at, we will end up talking about health and the different types of health research. So, but quite a good portion of our time today will be dealing not just with a definition, but with the classification of research and health research. And please, I'll say that if you have any question, please just indicate by actually raising your hand. There's a particular button that you press, and then your hand will be raised, and then I will stop to answer your question. Okay, I will stop. Okay, now let's just talk about what is research and what is health research. I would have loved to ask the class, for people, for students, to tell me what their idea of actual research is. Maybe I should give it a try. And so, students, I'm sure you have heard the term research before. So, what exactly do you think research means? Anybody? please let us discuss as the colleagues, the colleagues, I would say, that you are medical students, and one day, by the grace of God, we will all be colleagues. So, what is research? Anybody? Ah, okay. And it appears as if I hope you guys can hear me. Since nobody is actually giving me any oral feedback, maybe if you guys are not willing to actually feedback, then I'll just go through the session and then at the end I'll ask if anybody has a question. Okay.
Yes, sir. Good evening, sir. Can I attempt the
Ah,
question?
thank you so much. Yes, please go on, please. What is research?
So, research, I believe research is a systematic process, like is a form of investigation, by asking questions about a particular topic to gather information, to increase knowledge about a problem or to provide solution to a problem.
Okay, very good. Very good. That was very, very good. Yes, any other person? Okay, now one more person. Yes, you can just unmute yourself and you tell us what you think research is. As an example, if I ask you in your end of posting exam, define research for me, what will you write? One more person. Okay, I won't call names. I won't call names. Okay, fine. Let me continue. Thank you so much, uh, the speaker who answered. So basically, yes, thank you so much. So if you can all see, can you see my presentation? Yes? And I take it you can see. So the research, this is,
Yes.
okay, good. The way I, this is my definition of what research is. The research is a systematic inquiry about a problem, or put in a simpler way, uh, it is a scientific way of searching and for the answer to a specific question about an unknown situation. Usually a problem. Okay, usually a problem. Okay, in order to find new uh, knowledge about that problem that adds to what we already know or that adds to the body of existing literature on that particular problem. And therefore, there are words here that you need to know that are key to the definition of what research is. So if I ask you in your end of a posting exams, I will want to see the word or the systematic there. I will want to see the word inquiry there. I want to see the word problem there. I want to see the word, well, in a specific question about an unknown in a situation. And I want to see new knowledge because that is why we we do study. We do study not to repeat and then report what another person has done, but it has to be new. I actually know very many students and their projects by this particular definition. They might not be in a research per se. What many students do, which I personally discourage, is that they try to repeat what the other senior students have done. They choose the topics that have been researched on. No, most of our students and their studies concern KAPs or of a students, workers in the Unimed or Ondo. So that very many students have written their dissertation on topics that their senior students did during their own time. And therefore, they don't report anything new. So true research is a systematic inquiry about a problem situation. And it is a scientific process of searching for the answer to a specific question about an unknown, and about something that we do not know about that problem, so that we find new knowledge, something new that adds to what we already know. So this basically is what research is. So if you have any question, you basically raise your hand, and then I will stop and I will answer your question. So, yes. So, yes, and another person actually gave this particular definition, that it is the process of research and inquiry or investigation that involves a systematic collection and analysis of data to generate generalizable knowledge. So this is another way for you to say, to actually define a research as a scientific process, a scientific investigation, scientific inquiry, and by which we systematically collect and analyze data in order to generate evidence, new knowledge that we can generalize. Okay, so this is another way by which we may define a research. One thing that I want us to know as the basis of talking about how to research is that, because the research is actually the scientific way, a systematic way to find answers to questions about an unknown situation, or something we do not know about a problem we are concerned about. So different people have different views as to how that can be best done. Okay, therefore the question that hangs in the air for every researcher is, what is the best way to find the truth, to find the reality, to find the facts about what we do not know, about issues, problems that affect human population. So there are three schools of thought, a thought that we call three worldviews of a research. Okay, there is the school of thought that is called a scientific post-positivist perspective. Okay, so the people in this in a school, they stand by the philosophy of a research, that a true research has to be scientific. To be scientific means that the way that we define and we measure in a reality, uh, that it has to be quantifiable. We should be able to observe what is real about the problem we are studying, for us to call the process true scientific research. Okay, and so that the people in this particular perspective therefore deal with. Sorry about that. So, and the people with this perspective, they believe that, look, if anything is real, if anything is true about any problem that affects the human population, it should be observable. It actually should be measurable. It should be quantifiable. It no, it it should be objectively assessed. So, therefore, people with this view believe that only the quantitative research can be classified as true research, because it actually uses the processes that are objective, measurements that to quantify. So, and they hold that view. That is the first, as the perspective. And the second and the perspective is the social science view. These are the school of researchers that actually believe that, look, it is not every research that must be that the evidence must be quantifiable before we can say it is true on the research, because they believe that there are so many variables of the human population that are not observable. And for example, how we feel, what we experience, our pain. Who has ever observed quantified pain before? There is no test to actually quantify pain as an example. And therefore, the people in this particular school of thought believe that, look, that actually for us to truly find out the truth of the problems affecting the human population, we do not have to follow the quantifiable process. Instead, we actually follow uh, 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 the process that explores what the human population themselves feel about their real situation. And so the social science as a perspective says that, look, what is real, what is truth, what is a fact is the meanings that the people give to their own experience. As an example now, and I gave us the example of pain. Pain cannot be measured by any measurement at a scale in a laboratory, because the pain is actually within. The doctors do not feel pain. If patients don't tell you they are feeling pain. Yes, I know there are ways by which doctors can actually excite, parts of the body that are inflamed, but then you can press that part. If the patient doesn't tell you that he feels any pain, you still will not know. So there are variables that cannot be observed. So the social science perspective therefore believe that, look, truth is not what you can count or quantify. Truth is what the person going through that experience tells you. I don't know how many of us can tell from the face when a person is hungry. Yeah, and I know that in Nigeria, we say a hungry person is an angry person. But until a person tells you he's actually hungry, you have no way to actually measure hunger quantitatively. And you cannot say his hunger is actually 20% or actually 40%. No, hunger cannot be quantified, but yet the reality that a hunger exists cannot be denied. Therefore, the following, this scientific perspective alone does not measure every truth in the world of our human existence. So we need also to consider the social scientific, the sociological perspective of what is real and what is truth in our humanity. So the third worldview combines both. Says that so that is the holistic, pragmatic perspective. That is this school of thought that says using, doing research based on one of these two perspectives will not sufficiently explain everything that goes on within a human population. That we need to always combine both. When you observe quantitatively, then you can then explore qualitatively. And then you have the evidence from the two perspectives in one single research. So, and that is the third perspective. So please know how to actually describe these three perspectives, and you give examples. Now, for example, if we take these research approaches one by one, okay, and talking about quantitative research. Quantitative research, okay, and it talks about, yes, quantitative research is the scientific approach to research. Okay, so, and then if you use this research framework that you can see that you can see on the left side of the screen. Okay, so using this framework, let us describe the approach that is commonly used in quantitative research. The philosophy or the ideology of the scientific approach is that whatever approach you used, when we say it it is a systematic inquiry. It means that the process deals with what is objective. The philosophy is that truth is absolute. The philosophy is that truth or to reality is observable, and that it is also quantifiable. And he believes there are no two truths about one thing. There is only one thing, there's only one and a single reality, and that particular reality can be measured. So that if you actually talk about objective research, observable research, quantifiable research, you are talking about quantitative, the quantitative research approach. Now, the problems that are commonly investigated with a quantitative approach, they actually relate to what you can observe, the occurrence of a disease, where you can count how many people are sick or affected by a particular disease, that's in a community, in a household, in a school. Okay, disease occurrence can be is a problem that can be quantified. The causes of the disease, the effects of the disease, the trends of and then the other factors affecting them, very often they can be quantified. Therefore, if a problem can be quantified, then the research approach you need to use is a quantitative approach. And then the purpose, okay, quantitative research always seeks to investigate, seeks to determine, to assess, to measure, to estimate, to analyze. So that is the purpose. It seeks to count how big, how wide, how the spread, the distribution. That is the main purpose of a quantitative research. And then the questions that are usually asked, the research and the questions in a quantitative study, they are usually hypothetical, that shows predetermined suspicions. What are the factors? What are the diseases? Who are the people that are affected? Where is the problem? When did it happen? Which factors, which diseases, which problems? So that once you have any research question that begins with what, who, where, when, which. So the research question alone tells you that this is a research question that is best dealt with by quantitative research. Then before you then talk about the framework of the research approach as a whole, when you talk about the framework, okay, quantitative research, we say it is deductive. Deductive in that it wants to start the inquiry basically from what the researcher knows, and to actually discover what the researcher does not know. And so that quite a lot of the questionnaires, they are filled with questions, options, showing what the researcher already knows. And then the researcher goes to the community, to the study population, to find out what he does not know, but based on 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 the hypothesis of what he already knows. So that is what we call a deductive approach. Okay, that is because you want to actually deduce or make conclusions, practically assessed from the point of view of what you already know. Okay, Nokoje, you have a question. What's the question? Nokoje, can you unmute yourself and you ask your question? Okay. He has removed his hand that he raised. Okay, fine. Sorry about that. Okay, so therefore, quantitative research is actually deductive because we go from what is predetermined to find out something that is actually unknown, so that you can then make proposals. So because of that, you begin from a hypothesis, from a theory about what you already know or what you think is the situation, and then you go into the research trying to prove the theory that you begin with. So that approach is what we call deductive. Quantitative study is also rational, empirical, okay, logical. And one thing that is key, apart from it being objective, it is actually repeatable. Other people who have read the article that you published on the study, they might want to follow the same steps that you followed in order to get the same results that you got. That is only possible with a quantitative research approach. And then the study population, okay, that are used in the quantitative studies, they are usually in target population or a sample that is definitely representative of the study population. And therefore, the way we select our sample has to be random in order for us to eliminate bias. Okay, so, and this is what is done in every quantitative research. The qualitative, the quantitative designs, they actually include observational surveys and experimental clinical trials. Okay, and then the methods of the data collection, interviews, direct observation, and also clinical examination, laboratory test, scientific methods, definitely. Now, the variables, they are usually quantitative variables, where you actually define what is the determinant antivariable, the outcome variable, the precursor variable, the variables that you actually categorize, on this particular framework, they are usually quantifiable variables that can be measured using a quantitative research approach. So the data collection and the tools, yes, the data collection process is the scientific, and then the environment is also, well, the particularly in the experimental trials, the environment is also controlled, following steps that are scientific. And then the tools, they are always structured. Now, when we say in a structured questionnaire, it means the answers in that particular questionnaire, they are closed-ended the questions, and then they also give even multiple answer options as well. Structured means is that, okay, the answers, they are fixed. They are fixed option and answers to the questions that are asked in a quantitative questionnaire. Data analysis follows statistical measurements, that deals with the numbers. And then the way the data is actually interpreted, they are interpreted as facts. The hypothesis that has been proven, and then the evidence that is actually generalizable, and then inferences that are made based on statistics, the data that have been collected. So that these are the typical features of a quantitative research approach. So the other research approach, and then the typical features. Okay, before we go to the qualitative, so this illustration tells you the classification, the designs that are under quantitative research approach. So this illustration here, if you can see this, tells you there are two broad other categories of a study types and designs that are quantitative. So one, you have the observational studies, where you only observe events as they happen, without you influencing and controlling how those events happen. So all those studies are called observational studies. And then you have the experimental studies, where that, yes, you actually study, well, and usually these are actually intervention studies in which you actually control the environment of the experiments. And for example, and you want to try a new drug and a new device, okay, you need to actually test it under a scientifically controlled environment. And that is what actually makes it experimental, in that you are testing, you are trying under experimental conditions. So these are the two broad types. So under these two broad types, there are different study designs. Okay, one, in surveys, you have cross-sectional surveys. Cross-sectional surveys, they are actually surveys that involves you carrying it out at a particular time or, or, or period, and then using a cross section of your study population. Okay, usually cross-sectional surveys, they are descriptive studies, and they include record surveys, and population surveys, household surveys, and community surveys. So those are cross-sectional studies. A lot of the studies that our students do in the UNIMED, they are cross-sectional KAP studies, and I have been trying to fight it, that our students need to move beyond easy research designs. Always KAP, in the cross-sectional studies. Maybe with your own group, we can begin to sort of dare, doing doing other study designs, that your seniors have actually hardly done. So under surveys, you also have longitudinal surveys as well that are usually analytical studies. So when you talk about analytical studies, so the longitudinal surveys, they are studies that you actually observe the occurrence of an event over a period of time. If you observe into the future as they happen, then you call that study a prospective study. If you observe over a period of time in the past, then you call that retrospective studies. These studies usually examine records. And other people go to start asking people to actually recollect things that have happened to them in the past. And those studies, people often say, are affected by a fault called a recall and a bias, that people might not actually remember the truth of what has happened in the past. And therefore, records that have been made, that have been archived, so can actually be studied. So those ones are actually better than the memory-based retrospective studies. Okay, but there is one analytical retrospective study that is called case control study. So case control study, usually you can begin from a records, but you still go out to actually interview people concerning their past experiences, where, of course, the recall bias might still come in. So that, therefore, when you hear case control study, please know that it is a retrospective, analytical study. Whereas the one that observe the cases as they happen, based on the risk factors they are exposed to now. That particular study observes a particular cohort over the years, for them to be able to actually estimate the relative risk of a disease happening after exposure to risk factors. So that is the disease, that is the type of a study that is called cohort study or cohort control study. They are prospective analytical studies. They are analytical in that these two designs always use two study groups. One, the case or the cohort group, and then the control group. So that is what actually makes them no, that really makes them analytical. Besides the fact that they actually analyze causes and effect. Okay, and therefore you can use these two if you want to actually determine the cause of a disease and the level of a risk. You know, that a risk in a factor had or had in the past to be considered the cause of a disease, or actually the incidence of a disease that has resulted from exposure to a risk and a factor. So you need to choose the case control one if you are looking backward, or a cohort control one if you are looking forward. So these are what we call observational study designs. And then the other side, experimental studies, they are usually clinical trials of new drugs, new new devices, and new interventions. So for you to test whether they are efficacious, whether they will work under controlled scientific setting, before you release those drugs or interventions to be used in the human and a population. So for you to do that, so you do these experimental studies that are usually clinical. So there are two types: true experimental studies, and then false experimental studies. What makes an experimental study true or false is the random, and it's actually whether these study groups, the way they were selected into the study groups, whether they were randomized or not. Okay, so if you selected the intervention group, the control group in a randomized way, so that is the evidence that that experimental study is a true experiment. And it is false if you actually selected based on what is actually convenient for you. Okay, what the researchers call the purposive sampling, or convenient sampling. You know, where you have a set of inclusion criteria. Now, based on this inclusion criteria, you actually select into the intervention group and the control group. So those experiments or studies, they are usually called pseudo experiments. So pseudo experiments, and then if it has a control group, you
just complete them now. For the attendance, no? So what? Only go to the class and the come before here now.
Hello, can I continue? I'm sorry about that. So, yes. So basically, what you actually see here, there are the two types, the two groups of a quantitative research: observational designs and experimental designs. So Yeah. So let us go now to the qualitative. So if we use the same criteria that we used to describe the quantitative research, to describe the qualitative research, please, I want you to actually compare the two. And then you will see that the two research approaches, they are distinct. They are different. They are different in terms of their philosophies or their ideologies. Qualitative research is a subjective research, meaning it is not objective, which means it is not based on scientific and empirical facts. It is not based on actually numbers that you can count. Instead, it is based on the ideology that truth and the reality that look, they are actually relative. That you cannot, that one truth is actually relative in that they believe that the realities are actually multiple. That it depends on who you ask. Okay, truth. And my own truth will be different from your own truth, depending on how I feel or actually what I feel that you want to hear. So, and then you cannot say my own truth is wrong and your own truth is right. And the qualitative, if the researchers believe everything that their study populations tell them, because they believe that that is the truth according to them. So they don't aim to quantify truth. Rather, they aim to qualify truth. They aim to describe realities. Okay? And they aim to understand the meanings that their study of the population or their study participants give to the experiences, to what is happening in their real world, rather than for they themselves to come to the research field with their predetermined inner knowledge as the quantitative researchers do. So that is concerning the philosophy of qualitative research. In terms of the problems that are studied, that are best studied using a qualitative approach, studying what people feel, what people think, what people experience, what people believe, the opinions they have, their behavior, their attitudes, their practices, their process, their culture, their knowledge. So if you want to know what I know about what happens in my own world, the best person you should ask is me. Not you observing what you think I know, as the quantitative people will study. And it is good that actually we are able to know the types of problems that are best studied using qualitative approach. Feelings, experience, belief, opinion, attitudes, behavior, practice, process, culture, knowledge. Okay? And you cannot count all this. You can't actually quantify feeling. You can't also quantify experience, belief, an opinion. My opinion is mine. If I don't tell you, you don't know. Don't come to me with a checklist that asks, do you know, do you know, no, do you know the causes and the symptoms of a malaria? Quantitative people, they will ask that. And that is a closed-ended question, because I will only answer yes or no. And then if I say yes, you will go away assuming that I know. But the qualitative, if and the people, they will go one or two steps further. They will ask you, tell us what you know. And that is the beauty of qualitative research. No, they don't just end with yes, no questions. No, they dig deeper. They actually explore. No, that is the purpose, because qualitative studies wish to explore, to discover, to understand, to learn the meanings that the study participants give to the problems affecting them, rather than you, the doctors, coming to tell them what you know, and then you are just asking them to answer yes or no. So you can't count this, you can't quantify this. And true qualitative studies do not quantify their variables. So therefore, the research and the questions, they are exploratory questions. Questions such as how? How does this happen? Questions such as what happens here? Questions such as why? Why does this problem exist? So these are questions that shows you want to explore. You want to dig deeper. And you want to search for the opinions, for the meanings that the study participants give to these problems that affect them, rather than you coming to tell them what you know about what actually affects them, and you just want them to say either yes or no. So please know this. Therefore, the framework that is used in qualitative studies, they are what we call inductive. Qualitative research is an inductive research, because we begin from the unknown to the known. Unlike the deductive approach of a quantitative research, qualitative follows an inductive approach to go from what we don't know. We go to the field with a plain sheet, nothing predetermined, nothing that is actually written there, and we just go to discover the reality according to the people and according to the population we are studying. Again, I will say this is the beauty of qualitative research. Okay, therefore it is inquisitive, it is probing, it is descriptive, it is actually narrative, so that it digs deeper, just as so we are not only satisfied. For example, if we ask, what are the symptoms the symptoms of a malaria? The quantitative person will give me 5 options: A, fever; B, cold; C, rigors; D, this; E, that. And then they will now expect me to tick the ones that are correct. so that it will be yes, no, yes, no, yes, no. Whereas when you come to now do the qualitative, if not research, they will just ask you what are the symptoms of malaria, and then they will wait to hear what I will tell them, rather than for me to answer yes, no, yes, no, yes, no, to what they know, expecting me to confirm, what their own predetermined inner knowledge. So qualitative researchers, we are inquisitive, we are probing, we know, and the framework we use is an inductive, if not framework. The population that is used in a qualitative, if not research, we actually call them key informants. We talk to people who can give us the information regarding the topic of our study. For example, if I am actually studying the pain of childbirth, okay, and I will not go to interview the husbands and some women who have just delivered. No, I will go directly to the women who have just successfully passed the true labor, for them to explain to me the pain that they experience during childbirth. So those people who hold the information we are looking for, we call them key informants. And the way we actually select them based on a need-to basis. Okay, so that is what we call the theoretical sampling, where we actually purposively choose which people we talk to. And there are people who have the information, and we actually select as many key informants as to answer all the questions we have. And when all the questions we have been answered, we stop now recruiting new participants into our study. So that is the point where that is the point we call the point of a theoretical saturation. So that is how qualitative research selects their study population. The designs, okay, and the commonest and the designs, they are what are actually listed here. There are more that you can have narrative studies, biographical studies, ethnographical studies, case studies. So if we have more time, I can explain how each of them is actually different. Now, in the study methods that is used to collect information, there is qualitative studies use key informant interviews, key informant individual interviews, what we call KII or KIII. So we also use focus group discussions. Sorry, not actually ground, focus group discussions. Okay, or what people call FGD. You will actually hear that a lot. And then we also use document and reviews, and then we also use participant observation. So these are different from the methods that are used in quantitative research. The variables that are measured, they are also qualitative variables. We actually assess themes and the concepts and the categories, text. The data are always text data, no numbers. If you say if you say you have done a qualitative study, do not report ordinary findings using using numerical data. Don't say 20% believe that, and 40% believe this. No, that means you are actually quantifying your qualitative evidence. No, I will not accept that. Okay, so that definitely you actually present them as texts, as quotes, as the stories, narratives. So that is what actually makes up qualitative research. And then the data collection is always field-based. Always. You go to where your study population, where they are, where they live, where they can feel at home. And instead of you to actually invite them to the school so that you can actually talk to them. No, qualitative research is best done in the context of where your key informants live, their usual living environment. So that is why qualitative research is always contextual. And then the tools that are used, they are semi-structured or unstructured. What we mean by that is, one, they ask open-ended questions. And two, the questions you have, they are not actually structured with fixed options. No, you ask open-ended questions and you let them describe their experience, tell you to actually narrate, so that always gives you descriptive responses than to say yes, no, yes, no, yes, no. So that is what we mean by that semi-structured or unstructured. So when we have the time, I will differentiate that for you. So data analysis is always constructive, because in qualitative research, we always seek to construct new meanings, construct new theories from the responses that the key informants have actually given to us. They are not based on my scientific assumptions. Okay, we construct, okay, and we interpret. And so we actually organize data according to the themes. So that is why the process is called thematic analysis. And then the results are actually always emergent themes. And emergent themes because of the inductive approach. You always say these are the themes that have emerged from what the key informants told us. Okay? And so, and therefore, the conclusions always come in form of new theories, new hypotheses, new models that have been constructed from the qualitative feelings and experience and opinions, etc., of your study participants. So please, you need to be able to actually differentiate qualitative research from quantitative research. You can be asked that in your end of a posting test, okay? So that you need to actually compare, and you need to know that they are different, and then you need to be able to use these particular criteria to tell us how they are different. So if you have any question, you can ask. So these are the qualitative designs, okay? So this particular one tells you that, look, there are 4 groups of a qualitative study designs. Okay, you have actually, and first of all, you have these study designs that are best to study the lived experience of a people. So, and then these study designs depend upon whether it is an individual lived experience or if it is a shared lived experience. The individual ones and the studies, the designs that you use, and you can use a case study to actually explore the unique experience of a one person or a few that you will call a case, which means that you have one person or one group as a case, and you explore them. You actually examine them in depth, in detail, to get as much information as you can from that one person or from that one group. And that is what we call a case study. So the other one that is also individual is the biographical studies, where they actually narrate the stories of their lives, and then you begin to actually find out the the turning points that actually could be responsible for their individual experience. So that is the narrative study. Then the other 3, they are the designs that are best for a shared lived experience, where you actually talk to a group of people, okay? And for example, the grounded theory study method, how the people live, how they do their things, how they follow whatever is their experience, particularly when you are trying to actually relate what caused a particular problem, and you try to actually build up a theory from what they felt caused their problem to the outcome that you can now observe. So that actually the GTM approach always comes out with a process theory. And then you also have the other one called the phenomenological study, that actually studies the essence of what a group of people have experienced. And then the ethnographical studies, they are the studies of the shared culture of a particular community. So all these are all qualitative studies, okay? And then when you look at the other 3 groups of a designs, you have 2 designs to study the quality of a service. Then another 3 designs to study problem identification. Then another 2 or so designs or actually methods to study perspectives of either individuals or a group of a people. So these just gives you I hope it is a simple illustration, to actually show basically, the 4 different groups of a study designs that are qualitative. Okay, so when you now talk about the pragmatic approach, the pragmatic approach uses the mixed method approach. This approach is usually action oriented. It is actually holistic because it combines both quantitative and qualitative approaches in the same study, but actually using them in a different arrangement and in different depths. Okay, there is one group of mixed methods studies that are called the sequential mixed method studies. So in this one, you can choose to do the quantitative first, and then you go further to do the qualitative, which means you do one after the other. So, but the other types of mixed method designs, they are the ones that are concurrent or parallel. So this one means that you do the 2 of them separately, but at the same time, and then you now decide at which point you will converge both, so that you are able to analyze and to interpret their findings together as the evidence of your study. And therefore, sequential mixed method design and that we concurrent. So this actually illustrates how actually quantitative qualitative designs are mixed in studies that are concurrent, and then the 2 designs that are actually sequential. In a sequential research, okay, if you do the quantitative first, and then you go to the field to do the qualitative, so that you can explain the quantitative data that you have obtained. So you call that mixed method of the design a sequential explanatory mixed method study. If you do the qualitative first, and then you get the themes, the opinions, and then you use the qualitative data to now design your quantitative questionnaire. So basically it means that you explore first before you go to the field for your quantitative study. So that particular study, therefore, is called a sequential exploratory mixed method design. In the concurrent, there are also 2. You have actually concurrent triangulated design. Okay, which means the 2 parallel studies, they are parallel, they are separate. Okay, and then you actually mix them at some point later. You can also have a concurrent embedded design, which means you actually embed qualitative questions, in your quantitative tool. When you do the 2 of them together, rather than doing them now separately, at the same time, and so that actually you actually mix them up, as you go. Whatever whatever quantitative if the result you get, you also go to collect qualitative, and the two of them sort of enhance the richness of the data that you are collecting as you go. So that is the concurrent and embedded mixed method design. So please, if you have any question, just feel free to ask. So that when we now talk about health research, so any research that is done using any of these research designs with the purpose to actually understand the health needs of a human population, and particularly with an aim to improve human health. That is health research. Okay, and certainly it actually explores and investigates human health problems, understand our biological issues, develops new treatments and intervention. So this is what we call health research. Please know how we defined the research generally before, and now see how health research is now defined here. So definitely, WHO says the research is indispensable for resolving public health challenges. So, and it is good for you to know. And according to WHO, there are 5 types of health research. Okay, and according to their generic areas. Okay, so we have health researches that are used to measure the magnitude and the distribution of health problems. Okay, we also have health studies that are used to understand the causes, the determinants of problems. Okay, human and health problems, whatever those determinant factors are. So those are risk factor studies. So the third group, you have health studies that are that are actually interventional studies developing solutions, okay, that will help prevent, that will treat, that will, yes, and particularly that will give even templates on how findings of a research can be implemented. Okay, yes, that is the fourth one. So now the fourth one, okay, when you do a research so that we actually understand how to best implement and deliver solutions through our policies, evidence-based policy. That's another type. So those are usually the types of studies that are called implementation science. Yeah. So, and then the fifth one, and according to WHO, we also have studies that evaluate the impact of a solutions on the problem itself. So, in terms of the examples of these 5 studies, we have health research that we call basic biomedical research. These are actually studies done that are done in the laboratories. They're usually scientific studies that test human biological samples. Either, yeah. So no, so that is why they are called biomedical. Okay, and then yeah, we have also talked about an example here, in the clinical trials, and then we also have studies, studies that are epidemiological studies. Now, these are actually population-based in the studies that observe people, studies disease occurrences, health, lifestyle, of a particular population. Well, so certainly there are studies that are based in epidemiology, and then, and of course, you have public health research, which I am thinking most of the studies that the community medicine department will be asking you to do will be public health research, and rather than the other three that we have already talked about so far. We will not ask you to go and do biomedical research or clinical research. Well, okay, epidemiology is also part of a community medicine. So yes, but then there are actually researches that are actually categorized under public health research. Okay, these these ones tackle health related issues, problems problems in the community, and then the aims are usually on how to prevent diseases, rather than to just understand the disease patterns, the disease trends that the epidemiological studies will do. There's the focus is usually to come up with actually answers on how to prevent and how to prevent, how to promote, how to control diseases and improve the health of the study population. Then there are also researches that are health system research or health services in the research. So these are studies of the health care system. So they are not actually they are not population based. They are not also community based. They deal with studying how health services are actually provided, access to care, inequality issues, issues, care challenges. So all those are the health services is a research. Okay, the last one is, of course, qualitative research. Definitely, you can do behavioral or qualitative studies that explores human behavior and psychology, basically to help understand why and how people do the things they do and how it affects their health. So that these are the 6 examples of health research. Okay, and they are based on these five aspects that the WHO states are the generic in the areas of activity of health research. So now, just this last slide and there we go. So now for your study project, how will you identify a topic? So these are the four areas that that will help you identify a topic for your research. One, look at the issues, the problems that concern you, the community problems, okay, that you have interest in, particularly ones that you have a personal interest for any reason, neither because you are from that at a community or you have seen the level of how these issues affect the people, and you want to know more. So that is one thing that you need to have to consider first, your research interest. What are you interested in? So, and usually when you are defending your study proposal, and I think you might do that either in your 400 level or 500 level, we will normally ask you, why did you choose this topic? Your answer should be one of these four, or actually others. You can say that you have research interest. You can say that, yes, you are interested in this topic because you have an ambition to make a positive social change through research. That you believe that we do not understand that the problems that exist in this community, in this profession, no, we don't know enough as necessary factors around it. For us to make a positive social change, we need to study it more. Or you can say that, oh yes, you have found that, look, there are gaps in the literature. That, look, the books that you read, no, the articles you have actually reviewed have not answered this question, that question. So those gaps become topics for your further research. And then the fourth one is just that, okay, not actually interest, not ambition, not gaps, but that you are actually curious about probably a study that has been done elsewhere, and you are curious whether if you do it in your locality, whether you will find the same thing. So that if for you to find a topic for you to actually research, you need to look at these four areas. It is possible you may come up with a topic based on other reasons, but these are the four commonest reasons that lead people to choose the topics that they then conduct the research to provide new evidence, new knowledge, and co. So I think so. So this is where I end, and I now want to give room if you have any questions. Do you have any questions, please? Do you understand anything I have said in the last 1.5 hours? Somebody talk to me. Any question? Any comments? Okay. Okay, fine. Since I'm not getting the feedback that I was hoping to get, I hope you have gained one or two things from this particular study about about the definitions, the, the classifications of research and health research. And then I have also given you four areas for you to consider when you begin to search for a topic for your community medicine research project. So I say thank you so much. Now, hopefully, we will meet during your end of a posting examination. Thank you so much. Okay, bye bye.